Baltimore General, an episodic medical drama. Written by Blue Bolton. Episode 1, Transfer of Care, Chapter 6. Emilia balanced Jordan's chart against her hip, the latest lab results blurring before her eyes, while the monitors beside his bed punctuated the silence with their rhythmic beeping. The boy lay motionless, unnaturally still for a teenager, a web of tubes and wires connecting him to vigilant machines. His skin had taken on a waxy pallor that made the angry red surgical scar peeking above his gown collar look like it belonged to someone else. 3 days post-emergency surgery, and Jordan walked the knife edge between critical and stable. Emilia leaned over, checking his pupils with her penlight. Both contracted equally under the beam. Her shoulders relaxed a fraction. Small victories. "His platelets are still dropping," she murmured, the words hanging in the sterile air. "They were at 47,000 this morning," the nurse confirmed, fingers busy adjusting Jordan's IV. Emilia's forehead creased. "That's down from 62,000 last night." Her finger traced the previous page's numbers, and his fibrinogen levels aren't improving despite the cryoprecipitate. The ICU doors whispered open, and Emilia recognized Shaw's footsteps before she even looked up, confident, purposeful, the soft squeak of black sneakers against polished floor. Unlike the sea of standard-issue blue that filled the hospital corridors, Shaw's all-black attire stood out like a silent rebellion that somehow escaped administrative notice. Dr. Winters trailed behind her, his face a canvas of perpetual anxiety, today's expression suggesting he was bracing for imminent catastrophe. Shaw approached Jordan's bed, her eyes immediately finding the monitors. His pressure's 86/50. "It's been hovering around 90 systolic most of the morning," Emilia said. Shaw's gaze snapped to Winters. "Then why did you tell me it was stable at 110? The resident's face drained of color. I checked an hour ago." "An hour ago?" Shaw's voice remained low but sliced through the air. "This patient has active hemorrhagic complications, and you're reporting vitals from an hour ago as current." "I thought—" "No, you didn't think. That's the problem." Shaw snatched the tablet from his hands, her fingers swiping through records. "If you had, you'd have noticed his urine output has decreased by 30% since your stable assessment, suggesting potential kidney involvement." Winters' Adam's apple bobbed. "I'm sorry, Dr. Shaw." "Sorry doesn't help Jordan." She thrust the tablet back at him. "Go pull his complete medication history, not just what's in our system, but every prescription filled in the last 6 months. Call his pharmacy directly." Relief washed over the resident's face as he retreated, his footsteps quickening with each step away from Shaw. Emilia kept her face neutral. Shaw's methods cut deep, but her point stood. Outdated information could kill. Still, the public flaying felt excessive. Shaw's attention pivoted to her. "What's your assessment?" "He's actively bleeding somewhere. The question is where." Emilia's fingers adjusted the medication pump, dialing the rate. "I'm ordering a repeat coagulation panel D-dimer and fibrinolysis assay. Also requesting another 4 units of platelets and cryoprecipitate." Shaw nodded, her gaze falling on Jordan. For a heartbeat, something softened in her eyes, a hairline crack in her clinical armor that Emilia might have missed if she hadn't been watching so closely. "His mother?" Shaw asked. "Went home to shower and check on her other kids. She'll be back this afternoon." Emilia hesitated. She asked about long-term prognosis. "And you told her?" "That it's too early to say." Shaw's lips twitched with approval. Good. No false promises. The beeping monitors filled the silence between them. Emilia found her eyes tracing Shaw's profile. The strong line of her jaw, the permanent furrow between her brows, the curve of her lips, and the long, elegant neckline. His abdomen feels rigid, Shaw murmured, her hands gently pressing against Jordan's right upper quadrant. More distended than yesterday. Emilia circled to the opposite bedside. I noticed that during morning rounds. There's no bowel sounds in the right lower quadrant either. We need to go back in, Shaw declared, conviction ringing in her voice. Emilia's head snapped up, surprised by the abrupt conclusion. You want to reopen him? His clotting factors are dangerously low. Surgery could kill him? Shaw finished. So could waiting. He's bleeding into his abdomen. We don't know that for certain. It could be third spacing from hypoalbuminemia. His albumin was 2.1 this morning, which doesn't explain the rigidity or the dropping hematocrit. Shaw straightened, arms crossing over her chest. Every hour we wait, he loses ground. Emilia held her gaze. And every hour gives us time to improve his clotting factors before putting him through the additional trauma of surgery. The nurse glanced between them, then melted away from the bedside, sensing the storm gathering. Shaw's mouth tightened into a thin line. You're making a conservative call based on theoretical improvement. And you're making an aggressive call based on incomplete data, Emilia countered. Let's at least wait for the new labs and a repeat ultrasound. If there's free fluid or his hematocrit drops further, I'll back your surgical plan. By then, we could be transfusing him on the table while trying to find a bleeder in a pool of blood. Or we could open him up now and watch him bleed out because his body can't form clots. Emilia kept her voice level, though her pulse quickened. His platelets are critically low, Shaw. We need to respect that. Shaw stepped closer, her proximity forcing Emilia to tilt her head slightly to maintain eye contact. The move felt like a deliberate physical chess move to dominate the conversation. I respect his entire clinical picture, Shaw said, her voice dropping lower, including the fact that this medication has caused catastrophic bleeding in other patients who died while doctors waited for labs. The ghost of Grace Hanley materialized between them. Heat crawled up Emilia's neck, but she planted her feet. I'm not suggesting we do nothing, she said. I'm suggesting we prepare him properly for what could be a life-threatening procedure. Every minute we debate is another minute he bleeds. Every minute we prepare increases his chances of surviving surgery. Their eyes locked in silent combat. Emilia noticed, with strange detachment, how Shaw's eyes weren't simply brown as she'd first thought, but flecked with amber, the color intensifying with her agitation. She caught the faint scent of Shaw's shampoo, something clean and herbal, and realized how rarely she stood this close to the surgeon. Shaw leaned in further, her voice dropping to a whisper that brushed against Emilia's cheek. What if we split the difference? Order the labs and ultrasound stat, and while we're waiting, book an OR and start prepping. If the results come back before we wheel him down and they're stable, we reconsider. The proposal was more than reasonable. Emilia found herself distracted by Shaw's proximity, by the warmth radiating between them, by the intensity in those amber-flecked eyes that made the rest of the ICU fade away. We'd need to push platelets and cryoprecipitate regardless, Emilia said, her own voice matching Shaw's hushed tone, creating an unexpected bubble of intimacy in the sterile room. Already part of my plan. Shaw nodded slightly. Along with tranexamic acid to help stabilize whatever clots he can form. Add prothrombin complex concentrate. It might help bridge him. Good call. They remained frozen, faces inches apart, the conversation shifting from battlefield to alliance so seamlessly Emilia barely registered the change. Her awareness narrowed to Shaw's breathing, the slight rise and fall of her chest, the way Shaw's gaze occasionally dropped to her lips as if tracking her words with greater care. "I'll call radiology," Emilia said, rooted in place. "I'll speak with the OR team," Shaw replied, equally unmoved. The ICU door swung open, bursting their bubble. Dr. Reyes entered, tablet in hand, his eyes darting between them with poorly disguised curiosity. "Sorry to interrupt," he said, his expression suggesting the opposite. "Lab results are back on Jordan." Shaw stepped back first, composure settling over her like a well-worn coat. And platelets down to 39,000. PT and PTT both significantly prolonged. D-dimer is through the roof. Reyes handed the tablet to Shaw. "But that's not the most interesting part. His vascutril levels are 4 times what they should be for his prescribed dose." Emilia moved closer, her shoulder nearly touching Shaw's as she peered at the screen. "That doesn't make sense. His mother said he's been on the same dose for months." "Could be a lab error," Reyes suggested. "Or he could be taking more than prescribed," Shaw said. "Teenagers aren't exactly known for medication compliance." "Jordan is different," Emilia insisted, the memory of his mother's worried face surfacing. "He's extremely routine-oriented. His mother said he never takes medications without supervision." Shaw scrolled through the results, the glow of the screen highlighting the angles of her face. "Well, something's off. These levels aren't therapeutic. They're toxic." "What about his liver function?" Emilia asked. "Elevated transaminases, but not drastically. Bilirubin's normal." Shaw handed the tablet to Emilia. "This isn't liver failure causing medication buildup. This is excessive intake." Emilia's eyes traced the numbers, a frown etching itself between her brows. "We need to talk to his mother again." "After we deal with his abdomen," Shaw reminded her. "Reyes, get ultrasound in here now. Tell them it's critical." "Already called. They're sending someone up." Reyes glanced at Jordan. The boy's stillness reflected in his worried eyes. "What's the plan if it shows bleeding?" "Or," Shaw said firmly, her gaze finding Emilia's, "no more delays." Emilia nodded, conceding. "Agreed, but we transfuse platelets and clotting factors first and continuously." "I'll update the OR team." Shaw turned to leave, then paused. "Carter, a word?" Emilia followed her to the corner of the room, away from Reyes and the returning nurse. Shaw leaned in, close enough that Emilia caught that herbal scent again. "I know you're concerned about repeating what happened with Grace Hanley," she murmured, voice pitched for Emilia's ears alone. "But this isn't DC General and Jordan isn't Grace." The name sent ice through Emilia's veins. "I'm aware of that." "Are you? Because your hesitation feels personal." "My caution is medical, not emotional," Emilia replied, though the words rang hollow even to her own ears. "And your eagerness to operate could be just as biased." Shaw's eyes narrowed. "Meaning?" "Meaning surgeons see surgical solutions. It's natural, but sometimes waiting is the better option." "Not when a patient is actively bleeding." "Which we haven't confirmed yet." They circled back to their starting point, the momentary alliance evaporating. Shaw stepped closer, her voice dropping until Emilia felt the words vibrate in her own chest. "When that ultrasound shows free fluid in his abdomen, I expect your full support in the OR. No more debate." "And if it doesn't?" Emilia challenged, refusing to yield to Shaw's proximity. "Then I'll acknowledge your caution was warranted." Shaw's gaze held her captive. "But it will, Carter. I've seen this progression before." Emilia became acutely aware of their shared breath, of how Shaw's eyelashes cast tiny shadows on her cheeks, of the faint scar above her right eyebrow she'd never noticed before. The tension between them had transformed into something electric, still confrontational, but laced with something that made her pulse hammer against her throat. "Dr. Shaw?" The ultrasound technician's voice shattered the moment. "You requested an urgent abdominal scan." Shaw didn't immediately retreat, her eyes still locked with Emilia's. "We're about to find out which one of us is right," she whispered, the words intimate despite their competitive edge. Emilia met her gaze unflinchingly. "I hope for Jordan's sake we both are."